Sure, it was definitely high nurse turnover. The other thing was that we weren't doing enough for patients and families in our community in terms of pediatric care. We were transferring a lot of patients to their hospital because our services were limited. So the competency and practice level were not where it needed to be. So we felt that the only way would be to just call Jane and see what we can do together. So we have a contract, and the contract also required by Maryland state law for their hospital to become a staffing agency. The contract covers them employing our nurses and our certified nursing assistants, and it's a contract that runs annually, and we started with annually for now because we didn't know what was going to happen the first year. It has components in terms of sharing information for quality, so we created a patient services organization as well for an umbrella type of legal setup for us to be able to share data and share information for quality data sharing. And it also really involved a lot of quality metrics that we need to pay attention to make sure the intent of the contract was being met, in addition to other legal requirements for contracts like these. Well, they were the center of this engagement, this partnership, and we wanted to do right by them. We did not want them to lose anything in terms of salary, benefits. We didn't want them to lose seniority. So we wanted to make sure we painstakingly did a side-by-side comparison in terms of benefits and compensation in total, what it would look like for them current compared to what it would look like for them as a Nemours employee. So far it's gone really well. You have to continue to round and close the loop because any little thing, they'll interpret it as, they'll fill in their own gaps, the staff would. You know, they will assume that trays were not being picked up because we're in Nemours now. And we also had to do some work in our organization as well where they expected too much too soon from the pediatric nurses. So they would say, well, why aren't you taking this patient? You are Nemours now. So we're doing a lot of work on both sides, internally and externally, to make sure that expectations are really where they need to be so that there aren't any conflicts. And so far it's going really well. Yeah, I think a lot of hospitals, there are a lot of clustering of hospitals around and a lot across the country. And we tend to not knock on the other person's door unless it's initiated by someone else in the C-suite. CNOs should be empowered to knock on those doors themselves and see what they need to do to be stronger with a partner that probably has been long established as a competitor. You can compete on certain things, but you can't compete on everything. So using that mindset, what can you do and how can you engage a partner, another CNO at another organization? And it's similar to what we did. We crossed state lines to figure out what you can do to be stronger for your community. So there should be no hesitation, and leaders should be empowered.